Dr. Brandi Jackson. I'm one of the chief residents of psychiatry at the University of Illinois at Chicago.
Hey guys, I'm Dr. Brittani Jackson. I'm an attending family medicine physician.
If I could describe my journey in one word, I think it would be character building, hyphenating, one word.
2 words.
Because I just think that the journey of becoming a doctor is so unique that there is just no way you're the same person from the beginning to the end. You have to grow and change in order to actually complete the journey. So yeah, it's character building.
And I'm not gonna say rocky because I think that's overarchingly very negative. And there were good times. I'm gonna say hilly because there was a lot of ups and downs, definitely some lows, but there were some peaks too. It was just overall a roller coaster. So I think hilly captures that.
Our journey to medicine, I think, starts just being kids who are really interested in science. Even when we were really young, we'd be just like playing outside in the mud and with like bugs and trying to learn about the world, doing experiments, and we also did really well in school. But it's not like we grew up thinking that we wanted to be doctors.
Not at all.
Not at all. Yeah. I don't know.
And I also think it's important, at least for us who both ended up really gravitating toward underserved medicine and underserved work. So where we grew up, it was a really interesting existence because our hometown was actually very segregated. All the black kids who predominantly were lower income lived in one part of town, and then people with more money, white people, lived on the other side of town. We were on the side with black kids, and it kind of had a stigma about that part of our town. And so it was very interesting because there wasn't a lot of expectation about kids who grew up on that side of town. I mean, I don't think it was that bad.
No,
I don't think it was. It was.
I mean, it was a working class.
It was just working class, but it was very stigmatized because it was all primarily African American, honestly. So, but it was very interesting because we only had one high school in our area, which all the kids went to. So we would have this experience of being segregated or being with only African Americans at home, but then going to school, and especially being in like AP classes, some of the advanced classes, and being frequently the only people of color in the room. You kind of have this, this whole thing where you're flipping identities and trying to navigate that. It's really difficult, but I do think all that kind of set us up for really starting to understand how differences about people can change how they're treated. So how your skin color, how your gender, and how these other identities can affect how you're treated in our society. So I actually think that really in a way did shape us into becoming doctors, at least me. I think you too, who is particularly interested in underserved work, just kind of wanting to write that in a way, in some way. So I think that was important to our development too.
And I think another thing that's kind of unique in our story is the fact that we didn't decide to become doctors really until college. And at the time, I think we were pre-med early in college because we just thought, oh, we like science, who knows, but we didn't really commit to it until really over halfway through college. And in hindsight, as we analyzed it, I think we both realized that a reason we weren't openly wanting to be doctors is that we didn't know any doctors who really looked like us, and it's really hard to imagine becoming something that you don't see. And we didn't even have black doctors growing up, as in taking care of us. So it just wasn't on our radar of things we could truly become. Yeah,
I think it's very interesting. I think it plays into the whole imposter feeling that a lot of us, people of color, women, other minorities in other ways really experience. If you're not seeing yourself a part of spaces that you're in or trying to get into, it can be very isolating. You feel like, oh man, this must be a fluke. How I probably don't belong here. You feel a little off. You feel just kind of isolated. So I think all of those things like created a barrier, and why medicine really wasn't like the first thing. We weren't 5 years old thinking we're going to be doctors, but yeah, like Brandi said, it was really the end of college. I had went through a couple different careers in my head. I want to be a teacher at one point, English teacher. Was really interested in nonprofit work, international nonprofit work. I was a minor in global health. I think I was a lab rat. I did the basic science thing, because, I love science, and none of it really fit. So I ended up doing a pre-med summer program, kind of just because it was advertised. I wanted something to do over the summer, and ended up seeing my first black doctor in the flesh. She had dreadlocks. I will never forget it. I was probably 20, 21 at that time, and it just, honestly, I was just like, the hair just went up on my arms, and I never said anything to her. She was literally just walking down the street. Never talked to her, didn't interact with her, but it was like, oh my God. It was just like, you realize I've been really thirsting to see that, or, and it just hits you. Yeah. So that was a really big moment, and I really feel like it opened my eyes to like, hey, maybe you can,
Yeah. And similarly in college, we both studied abroad in different parts of Africa, but I was in East Africa in Uganda, and I spent some time in a hospital there, and it's Africa, so everybody was black, doctors, nurses, everybody was black, and I was just looking around like, wow, look at all the black people in like white coats, and it's just amazing, and they're like really helping people, and I think that it really settled in my head, like, okay, I can be a doctor. It's possible. And it's crazy because it's just crazy to think that when I hear colleagues in medicine who say, oh, I had stethoscope toys.
I know.
It's just such a foreign idea.
Getting hooded by their, dad or grandpa or grandmother, or not grandmother, but mother, who is like doctors. It's just like a spectacle, because it's so different. It's such a complete different reality from anything that we experience.
And there's a lot of people who have family members who are doctors, and you go to when we went to medical school, there were people who just already knew the culture of the hospital, knew like how it's laid out, and what the role of an intern or a resident is, even knowing what a fellow. How
do you round?
I don't even know what a fellow is.
What is rounding? I remember saying, what is rounding?
Yeah.
What do you actually do all day?
Yeah.
And just the structure of the day.
And so
going into third year.
And it's not that you can't learn that stuff, but it's that when you are constantly not knowing it and having to learn it, and you have colleagues who seem to just get it, it really can settle into your psyche and make you feel like you are in a space you're taking up a space that doesn't belong to you. Mm-hmm. And I would say for both of us, that feeling that we're in spaces that we shouldn't be, even though we had the grades, even though we both went to an Ivy League undergrad, we had stellar CVs, resumes, test scores, for the most part. Even despite all those things, we often felt like we were just kind of stole a space, so we shouldn't be there. And it's meant for the kid who's like their parents are surgeons and things like that. Yeah. And deprogramming that has been, I think, the most important part of our journey.
But I also think it comes from inside of you, like insecurity inside of you. But I also think people kind of look at you and think, oh, well, they got it because of affirmative action. Mm-hmm, and, they kind of look down their nose, or, why are they here? And I think you're human. So that's going to bleed into your psyche as well. Like, people underestimating you, or, making assumptions about your abilities. Mm-hmm. Eventually you start second guessing yourself. And for a lot of us, especially as African Americans, as women, we don't have people in our corner constantly building us up. Mm-hmm. And especially in medicine, the culture of medicine is so it's very negative. It's a very negative space. It's very much trial by fire. It's very much like, grin your teeth and bear it, and kind of just put your head down, get through to get positive validation. It's not going to happen as a med student for the most part. Yeah. I mean, it's very few and far between. So it's a lot. It really is a lot. And that was a struggle too. Finding cheerleaders. Honestly, finding true, honest cheerleaders who were invested in your success and clearly rooting for you. I mean, especially even third year, or, just with so many transitions that you go through in med school. You're with one team, then you're with another. You can't put down roots, so it's difficult.
Yeah, and I think really the institutions in medicine have a lot of work to do when it comes to helping people feel included in the training process. I literally in medical school, when I was a third year, had an attending refer to our all black patients. They were all black patients in the hospital in Chicago, and he referred to them as animals. And it was I remember it was not the first time I had witnessed just frank racism in medical interactions, but it was, I think, the most egregious. And I remember, that he said it as part of a joke, and there was a few of us standing around, and people chuckled, and I kind of chuckled too, and just felt horrible about it for so long. And only as I've come to the end of my training have I realized that as a medical student, how vulnerable you are to the system, to your superiors. The culture of medicine is very much about not speaking up against people who are higher than you in the hierarchy. So at that time, there was a lot of pressure. I think me now, being more confident and being on the high, coming up out of the training process, it would be completely different. But to forgive myself for that moment took years. Years. And those are the kinds of wounds that you carry, and that many of us, meaning, people of color in medical training, pick up along the way. And I think the institutions that we're moving through have a lot of work to do to try to recognize the additional emotional burden.
It's trauma.
It's trauma. Micro traumas, microaggression, and sometimes overt traumas that are done to people of color as they try to become healers themselves.
And I also think there's just no outlet for that. There's nowhere. Who do you go to talk to about that? The best you can do maybe a counselor or something.
Mm-hmm.
And I also but they may not even completely understand. Maybe they can empathize, but they can't understand until you've walked it. And another unique struggle, I think, as a person of color in medicine, is the sense that if I mess up, if I don't do well, if I don't perform at the top of my game, the weight of the entire race is on my shoulders. If I don't perform, they're gonna say, you know what, we gave that black person a chance. This is why we shouldn't have done it. They messed up. Let's think twice the next time we want to recruit a person of color. Mm-hmm. And that's just such an extra psychological burden, and it's very real. It is very real. So like when I would mess up, it would be more than just me self-flagellating because I messed up. It's like, you messed it up for yourself, and you mess it up for the next people trying to come behind you. So you always carry their ghost. They're always on your shoulder. So I think that's something that a lot of other people may not have to carry, and it's a weight. Yeah. And it's unrecognized, and I think it's something that I didn't realize. Again, when you're in it, you may not realize that you're putting that extra pressure on yourself. Mm-hmm. And as I went through it, just to even give yourself permission to not be perfect is something that I had to learn how to do. Mm-hmm. And if people use that against other people coming behind me, I can't carry that. I can't hold all that responsibility and still perform at my best. It's very difficult. I still feel it, but it's not as consuming when I make a mistake the way it was.
Mm-hmm. Yeah. And the other thing I just want to add is that when, particularly, you're a black person and you're on the medical training pathway, mm-hmm. along the way you find other people of color, other black people who stop and say, keep going, we're proud of you. And that's a unique kind of pressure. Yeah. It's good, but you name it, janitors, patients who are literally sick saying, keep going. So I think that there is, unseen to maybe other people, there is this kind of network of communication that you come into a team and you're wearing the white coat, and maybe you're the only person of color on the team and the patient is a person of color. They kind of look at you and say, you see me, I feel relieved. And so trying to live up to that and make sure that you're doing right by that person, it's another stressor. Yeah. And I would also, again, add that at least in a lot of the hospitals I've worked at, there are less doctors of color than there are other staff members of color. So like your clerks, administrators, janitors, people in the cafeteria. I personally get to know the people who work around the hospital who are not doctors, and I've been hurt seeing my colleagues treat them not with less respect than I think that they are owed. Mm-hmm. I guess there's a part of you that sometimes wonders what role race plays in the mechanics of the hospital. And you may be in a relative position of power because you're on the medical team, even as a student, but there's still, at least for me, I feel an obligation to try to fight for equity for other people, even in the medical institution. So there's a lot of layers of what I think of as emotional labor that are largely unseen by people who are not minorities. And I think that may help, that if they understood it, they might understand, like if they could really get a window into it, they might understand why becoming a doctor is such a unique journey for people of color. We have all the regular stuff, and then we have layers of this other stuff that we're managing that most people don't even realize.
Well, even when you said that, that made me think of, when you see people respond differently to janitors or, food service workers who are like some of the best people and it's just the best. But sometimes I wonder, am I only of value to you, or am I only visible to you because I have this white coat on? And what if, or even how they talk to patients sometimes, like, am I only of value to you because of this education, this pedigree, or whatever? And, you can really see that we are not valued because of who we are. Simply, you have to do all these other things to be of value in this world, in the medical world especially, and that's just the way it is. It's a big game. You have to play the game. I'll give you another example. Nobody apparently, no one wants to respect medical students, and they have no power. But those are the same people who are going to be attending one day, and all of a sudden they're worthy and they're valuable. Why weren't they valuable as students? It's the same thing. Why am I valuable now that I have an MD? If I was just a black girl who's playing, playing in with bugs, I didn't have value then. And I think that weighs on you. It's just like, it's so, you see that, it stares you in the face. You are treating me differently now. And and you just reflect back on all the people who don't have these privileges. And, it's kind of just, it's a weird environment. It's weird to work with people when you see that out of them. And this is not everybody, but you certainly see it. And I think psychologically, that's just, it's a pressure. But then again, it's a fuel as well to, like, I've got to be a voice or try to amplify the voices of others since I'm in these spaces.